second conversation for today, equally important, with representatives of the Ministry of Health. We have on set with us the CEO in the Ministry of Health, Dr. Ramon Figueroa, and we're also joined by Dr. Javier Zuniga, who heads up the Central Health Region. Good morning and welcome.
Good morning.
Good morning. It's a pleasure to be here.
Of course, we're happy to have this conversation as well. April 7th is celebrated worldwide as World Health Day. And this year, the global theme is talking about universal healthcare or healthcare for all persons. Let's talk a bit, before we dive into the healthcare part, just how you would gauge how this theme fits for Belize. Let's start with that, Dr. Figueroa.
Well, I think it's very relevant. Actually, it's a, as you said, global event, 7th of April. As you rightly said, the theme is universal health care, everyone, everywhere. That's basically the theme. And it's absolutely relevant for Belize because that's really the aspiration that we have here in Belize to move towards a universal health care type of healthcare system. Remember, it's not something that you achieve overnight. It's a work in progress. It's an aspiration. It's a goal. And we've been at it from 2000. Well, actually, the whole thing started in 1978 with the Alma Ata Declaration of Health for All. And it has evolved. The concept has evolved over time. And so we have been at it from way back. You know, it's, as I say, it's absolutely relevant for us. It's part of our strategic plan.
Yes.
We mentioned it in strategic plan. In the development plan for Belize, it's included as well. So it is absolutely relevant for us.
Yeah.
I have a very basic question before we get into how healthy is Belize comparatively? You know, how healthy is Belize?
I don't know how basic that question is.
No,
compared to our neighbors internationally, where do we stand?
We're pretty good when we compare ourselves to our neighboring countries and even in the Caribbean. The other day I attended an IDB-sponsored presentation at the Radisson when they were talking about the development report for Belize. And it felt quite good hearing that one of the elements that they looked at was our health status compared to Central American region. And Belize is actually at the top of the list in terms of achievements in Central America. Probably comparing with Costa Rica and Panama, who are normally traditionally way ahead of us, but we're comparing with them. When you look at infant mortality, maternal mortality, which are indicators that sometimes evaluate the performance of the health system.
Yes.
We're way up at the top.
Yeah.
Wow.
I was going to say that. I think we have some pretty good grades on our report card for health, and we have some areas that are very critical. But when we look at vaccination, or vaccination coverage, which is, what is it, 90?
We're about 95, 97%.
97%. And I know you were speaking about infant mortality, which are the number of babies that die, maternal mortality, which is how many women die when pregnant or after childbirth. And these are really great indicators for a developing country like Belize. What do you attribute to the success in these particular areas? These are great indicators. These are what are used globally. How have we been able to get there?
Because traditionally Belize has, one of its strong points has been the primary care component of the system. We've had an extensive network of health facilities countrywide. We have pretty good coverage. We have a group of nurses that traditionally form the pillar in the past, that formed the pillar and continue to form the pillar of healthcare delivery in this country. And we had focused on that. A lot of our investment attention has been at the primary level, outreach, ensuring that we have good coverage, that we have good information, that we know where people are who are not vaccinated, that we try to reach out to the women who are pregnant and are not coming to identify high-risk pregnancies. So there's a lot of work that has gone into the outreach program, the identification of high risk, and the quality, improvement of quality of services. I think that has been primarily the reason we have been so successful and have achieved such grades in terms of for Belize.
Yeah.
And just to go back to the Alma Ata, as Doc was saying, Belize was actually one of the first countries to implement primary health care as the pillar of the health system. And this goes back all the way into the early 1980s. And based on focusing on primary health care, as well as what Doc was saying, it has helped in some way to achieve some of these targets that we measure countries as developing or being developed as such. And as Doc rightly said, those, instead of having people coming to us, what we have focused on is moving and having health more accessible by moving into the communities so that people could access services more easily. And that's what the health system has been focusing on in the past couple of years.
Yeah.
The other thing, and I can't miss this opportunity, is to say that health is not only health interventions, by the way. So the results of a healthy population depend a lot on having good water. And if you look at our indicators in terms of water coverage, potable water, it's excellent compared to other countries. And so those things also attribute education. Those things also are responsible for achieving some of the health results.
In terms of primary health care, am I right in saying that primary health care is maybe one of the cheapest of the, I think it's three levels of health care?
Yeah.
That's right. Normally you have primary, secondary, and tertiary. Traditionally, that's how we divide it.
Would it be safe to say that primary might necessarily be the cheapest and probably the easiest?
Let me correct that.
If that is,
let me correct that.
If that might be so, or more affordable, and probably a little bit easier than the other two, because the other two include surgery and medication and more specialized training, can Belize take the next step? If it is that we've done good, we're doing well, but our focus and our success has been primarily in the first stage, can we get to the second stage?
Well, number one, primary health care is not cheap. And I think we need to, because I think when we started Almata at the beginning, the conception, the perception was that this is a cheap way of providing health care. It's not cheap. Health education, which is a primary component. And again, the other thing is that you can't just say, well, provide only primary health care. You have to provide across the board and do a well thought out investment where you're going to get most bang for your buck. The thing with primary care is that that's where you get the most bang for your buck. You need to invest in it. It's not cheap, but you need to invest in it. But the long-term results of that investment then affect all the other levels. So you have less, if you do proper education, health education, preventative, if people engage in better nutrition, more exercise and lifestyle, you know where I'm going there, then you end up with less people coming to the hospital. Healthcare is more individual responsibility or not. A lot of people think when we're talking about healthcare, they go, oh, Ministry of Health, oh, it's an individual responsibility. The state is there to provide assistance and support, information, guidance, and attention when you need it. But at the end of the day, health is in your hands. So if you do proper nutrition, you won't end up with diabetics and hypertension. At least the majority won't end up with that. You won't be obese, you won't have cholesterol, you won't have all the other problems.
And I want to challenge that a bit, because I also think that, I feel that yes, people have an individual responsibility to take care of their health, but there is a role for government agencies, and there is a role for policies and legislation. You have to ensure illegal substances aren't available. For example, improper medication, access to unhealthy food, and access to healthy food, even more so. And I think that's where sometimes I don't always hear a connection being made, that there is a mutual responsibility, if I can say. But that brings me to the areas. We said the report card was really great. These are the ones that, you know, if you take your report card home, people say, oh yeah, I expected that. But there are some areas that are critical. And I think it fits in with the global issues that we're seeing. And I know Dr. Zuniga was the one who had to brave the media and talk about how fat we are as Belizeans. And I'm saying it bluntly. I believe it was a year, 2 years ago, you said it was 2 out of every 3 Belizeans are either overweight or obese.
That's right, or 7 out of 10.
7 out of 10. So that's a critical situation that has to be addressed. This obesity, which is now considered a disease, can lead to the issues that we know a lot of people have: diabetes, hypertension, cholesterol problems, heart problems, impact cancer. Thank you, cancer. There is no that the WHO has now said cancer is one of the risk factors for obesity is one of the risk factors for cancer. But it ties in to the productive sector. If I'm sick, if my pressure is high and I have to spend 3 days in the hospital, I'm not at work. Social Security has to pay, and there are other implications as well. So what I'm saying is, as much as it's individual responsibility, there's impact as well. So let's talk about those critical areas and what's being done and what can be done.
Yeah, we go back to primary health care because that is the basis of the health system. As you all know, in Central Health Region, we basically focus on primary health care.
Yes.
Our secondary, tertiary referral hospital is KHMH. And our focus is not only to prevent, promote, we also diagnose, early diagnosis of all these conditions that you've been speaking about. That involves screening of these individuals. So we try to get people, and we're speaking about healthy people, so we try to create wellness, and that's what we have been based on, creating wellness in our communities. Bring people into the facilities or go out and find people into the communities, have them do these screening tests, and that has to do with all these NCDs, non-communicable diseases, the cancer screening tests that we need to do, so that we could do an early diagnosis. If there's an early diagnosis, then we can prevent the complications. Yeah. And that's what Doc was also speaking about, having these people then end up in secondary and tertiary care. Yeah. So once we focus then on primary health care, we invest in primary health care, and it's not cheap. It is expensive to invest in primary health care. Then we prevent these individuals from ending up with complications, and that's what we want to do. We want to have wellness and create wellness within our communities.
I want to pick up something that you mentioned. Well, first of all, I didn't imply that government doesn't have a role. All right. They have a major role.
Yes.
And our responsibility, because we form part of the government structure, is to ensure that we use the resources as efficiently and as effectively as possible. You never have enough resources to cover, and I think we have to be very clear with that. People expect you to cover everything, but you can't. If you have $100, you need to see how you spend that $100 wisely. Where are you going to invest it to get the majority, and so on. So, yes, we have a responsibility. The second thing is that if you look at the causes of mortality, and the top 5 causes, which are about 60% of all people in Belize dying, have to do with lifestyle diseases: cardiovascular, heart, hypertension, diabetes, and cancers. You have also injuries, but that's another. You have the violent injuries and those things, which
and
is
also
another
road traffic accidents.
Road traffic accidents. They're preventable. They're preventable diseases. And a lot of them, and what I was getting at is that a lot of them have to do with interventions way from when you're young. You develop the good eating habits, you get into doing exercise, address the issue of obesity. But it also, the other thing I don't want to miss is that it has to do a lot with other sectors as well. It's not only Ministry of Health. You have to do in education department. So we're trying to work with education to include.
Can I jump in there, because I really wanted to touch on that issue as well, and I think you are absolutely right. I think the education sector cannot be ignored from health, because all our practices and habits we learn as children, and I know that there was the food basket that was launched for Belize in terms of understanding what we need to eat. But sometimes I question how much people are really receiving this information. People want to get healthy, and then they say, oh, well, I just stop eating bread, or I stop eating, which isn't so bad, but then they still have ice cream and lots of cheese or something else. But my point is, there seems to just be a basic misunderstanding as to how to be healthy. We know we should exercise, but we don't always know how to eat. And it's something that has to be taught from a very young age. If I knew how to eat properly from when I was small, I'd probably be more comfortable making those decisions as an adult. I may not always get it right, but I'll probably know that. And then also, if we just look at what's offered in the school, and I'll go back to the same issue I always talk about, why are schools inundated with so much candy? If we know that we have a problem with diabetes, and even children with type 2 diabetes.
Right. Well, there's the issue of policy development, and you rightly said that's our responsibility to try to develop policies that address some of these issues. And so we've been working with the Pan American Health Organization and with education to develop policies for school at the school compound to eliminate sugary beverages, and so we're working on that. On the other hand, we're also working with, there's some project with agriculture and education in schools in certain parts of the country, I think Corozal and the South, where you're starting to have school cafeterias, locally grown products, teaching the children how to prepare healthy food. So there's a lot of initiatives, and this, as I said, this is a work in progress. You're very right, but it's not as easy. It's not easy. It's easier to say that we need to work with other sectors.
Yeah.
It's harder to do. Fortunately, I think we've had a good working relationship with education, agriculture now, and human development in other areas as well. So child growth, development, stimulation.
And what about, we've seen where the sugar tax has been effective in the Caribbean and in our good friends right above us in Mexico. Their indicators are saying that especially there's more of an impact in the poorer people not drinking as much sweetened drinks as they used to because they increased the tax. I know in conversation with people from the health industry in Barbados, they also work with local producers that they cut down on the amount of sugar they're putting in their locally produced drinks. So it's not necessarily to stifle the market, but also to make it just more health conscious for their target audience, which is young children. Has Belize considered moving in that direction? And I know we just moved off a conversation and we said less taxes, but this is also one that we are seeing is impacting in a good way the health of people in other countries.
Absolutely. We've sat down and discussed a whole list of foods and proposed taxation. I mean, I didn't hear the previous one, but I think taxation has a role to play. You can't overtax, but there's a certain tax that I think you need to. Health tax, I think, is something that has to be considered. Health service is not free, and tax on products that affect your health. So we've had a list of products that we've discussed, introducing possible tax on them. And interestingly enough, one of the discussions when we were discussing this, one of the arguments was, hey, but this food is what poor people eat. So why you want to tax it? Yeah, but it's affecting the health of poor people. And at the end of the day, it's going to cost them a lot more, and the government a lot more. So tax it so that they don't eat it. It's protecting people who are buying these foods, because it hurts your health, and it's costing you and your family structure. In terms of that. So,
but it's weird because in Belize, I always tell people I see in every other part of the world, the size of the sodas are shrinking, and in Belize it's growing.
Yeah.
So how is that possible if we're really being serious about preventative health policies?
Yeah, maybe we need to sit down with the producers and discuss these issues. We're trying to do it from a policy where you prevent the access to these sugary drinks at the school level. But I think an idea is to sit down with the producers and discuss mutual benefits. It's not to stifle, as you rightly said, it's not to stifle development and the economy. But at the end of the day, a healthy population is also conducive to a productive population. So it's mutually beneficial.
See, Dr. Figueroa, there's a reason why we have a ministry, and it's because the ministry is a leader. It's a policy-making decision. Most people, like a doctor and a patient, when you go into the hospital, you can't be making decisions. That's why we have leaders who are in there and say, okay, you had a gunshot. We're going to administer treatment to you in this way. And so,
I don't think they have time to talk to them.
If I can't hear them,
Go ahead.
but I actually put the reverse role. I think that the full responsibility to move us from where we are is in the hands of the ministry. Because there is no way that somebody who is poor, who's looking, I can't afford to buy broccoli, but ramen is 50 cents.
Yes.
that's what we're talking about. Yeah.
If the same argument was made to cocaine, we would not tax cocaine, we would make it illegal.
Yeah.
I think, do you agree with me that the conversation probably is too polite to say, yes, you can afford it, but in the long term, which is difficult for persons who are poor, they cannot see in the long term.
Right.
That we should take the further step to say, we're not going to sugar tax it. We're not going to increase we're going to simply
Ban it.
remove it.
Yeah.
Your reaction?
Dr. Figueroa is thinking of the
He's shaking
response.
yes, he's doing
I'm guessing you've said this before, but there was another reaction you.
It's easier said than done.
Of course.
Because in the other countries that we've seen it implemented, they've had so many barriers, especially with the commercial sector. And in the end, it took political will to have it done.
Yeah.
And when they saw that it was effective in countries where it was implemented, that's when other countries started taking up the same action. But again, it's, as I said, it's easier said than done. There, it is in the talking though, and the Ministry of Health and all the TAs, the technical advisors, have been speaking about it. So it will occur, but it has to be in phases.
Dr. Figueroa wants to get in on this. Dr.
Yeah,
Figueroa wants to get in on
I
this.
mean, and I'll be blunt. From our end, if we could do that, we would do that.
Yeah.
All right? But the real world works
The real
totally
business,
different.
yeah.
Because it's a big lobby, it's a big economic sector, and you just can't go and say, "Here what? I went." I like Ali boy gonna tell you, "Here what? You want to sit down."
Yeah.
I could tell you that, but I can't force
But
it.
you
Can we
are
afford,
allowing-
there's-
can we afford not to?
From a theoretical
Answer would be
standpoint,
no.
I agree with you. From a theoretical standpoint, I agree. But in the real life, it's difficult. I would topple government. It would because
gentlemen-
just like the pharmaceutical industry, it's a huge industry.
We're being
Yes.
toppled economically, and we're being overburdened. The health sector cannot afford it. It's a real conversation. Practical
It
issue.
is.
And
It
then,
is. It is.
and
I
then we
mean,
haven't moved into the healthcare aspect as yet, because I think when we think of people who simply cannot afford treatment, some people get a cancer diagnosis and it's a death
With
sentence.
sentence.
Getting a biopsy is not affordable for your average person. And now we're moving towards having it available in
Dialysis.
some of the healthcare sectors. But I mean, these are real. When we hear stories of people who are diagnosed with cancer and have no options, and even if they do, they put themselves in debt and then still lose their lives, and the family is left behind with the burden. So I know that it seems very punitive, and I'm sure people are watching thinking we are absolutely crazy and facey to say things like this. But that's why we do have leaders to hopefully make decisions on this behalf.
Hard
Now, I have a
decisions.
comparison to make. And this is what I find interesting. We recently moved what I consider to be a fantastic decision to remove single-use plastic bags and styrofoam
Excellent.
from
Awesome.
the
Excellent. Absolutely.
environment.
Excellent.
It is a
Absolutely.
wonderful
Awesome.
decision. I applaud all who lobbied for it. And that cuts down on the impact of these materials that we're going to have long-term damage on our environment. I use that as my example to say it perhaps wasn't popular, because actually the biodegradable bags and plates cost more. But it was effectively done. And the styrofoam, it's not going to impact you next year. It'll impact you it'll impact Mother Earth many years in the future.
And the health as
We're
well.
talking about food that can very well impact people by next year, sometimes by the end of this year. And we can't get the push to make some more stringent decisions. Why is that so?
Yeah, it's
Heavy.
heavy.
That's
Yeah,
heavy.
I guess it's a complex the answer is complex. I mean, you have economic interests in there, which you have to deal with. I think the best way forward is to probably sit down and start a discussion and dialogue as to move. And the last option would be to, if you don't want to join us, is you stop it.
Yeah.
Yeah.
And I want to go back to when
But
we
you need to
speak
give
of-
alternatives, by the way.
Yes.
True.
You need to
Yes.
give alternatives. You
Yes.
can't just say no. You need to give alternatives.
Yes.
Absolutely.
And we go back to universal healthcare. It doesn't mean free health for all,
Yeah.
It's providing essential health services to all,
Yeah.
so that it's accessible without having people going to financial hardship.
Yeah.
Because if we try to provide free health services across the board, primary, secondary, tertiary, it cannot be sustained.
Yeah.
No country can sustain that type of health service.
It's actually better to keep them out of the hospital.
That's right, and that's why we're focusing on primary
prevention.
health care.
Yeah.
And throughout, if you do a cross section right now, and you say, all right, prevention, we need to do prevention. Yeah, but you have the situation right now where people are in dire need, and so that's why I was saying it's a challenge to take the limited resources and to try to spread it across to be more efficient and effective. And the reason I'm saying this is that to pick on one of the things you say, it's heart-wrenching to see people who are diagnosed. Let me take cervical cancer.
Right.
You do a pap smear, you find out that you have stage 1 cervical cancer. But let's say you're looking for the treatment, people go around starting to see where they can get it. And by the time they get the money, then don't they in a stage 2,
4.
stage 3, stage 4.
Yeah.
Then you have no option.
Yeah.
When you look at people with on dialysis, which is another thing that's heart-wrenching, you know, when people come and ask you to cover their dialysis sessions, I mean, you already have an
It's a
investment,
triage.
major investment in 2 facilities where you're covering, and this is something that I have a problem with, where you're asking people to come up with $15 to pay for their session, and people refuse to pay the $15 to the facility. It's nothing, but it's something that you can reinvest in the $15 compared to at one time we used to pay $1,500 per session, then went down to $900. Now in the private sector we get it for $240. You have in 2 facilities, limited as it may be per individual, you're asking them to pay $15. Some people just refuse to pay it, but then come out and then go buy Coke and then go. Those things also has to do with core values
Yeah.
or social values. But then you see people outside that want to come in, and you can help just so much. And
You can't take one off the machine to put the other.
no, you can't. And then you can assist with maybe 2-3 sessions, and they come to you, and I know they're desperate and they want you to cover the whole, but you can't. And that's the heart-wrenching part, because you say, you know, if we made hard decisions 10 years, 15 years ago, this wouldn't have happened.
Yeah.
We wouldn't be in this situation, but we need to make decisions now for the future.
Can I push us as we're getting to the end of the conversation? Something that's dear to me. When we talk about healthcare, mental health in this country is the forgotten child. It's the middle child. It's just completely forgotten.
It's a hidden problem, I call it.
Yeah. Where are we there, and what steps are we taking to pay attention to this disease that is rampant?
Actually, we have moved into having mental health as one of our major priorities in primary health care.
Fantastic.
One, we know that almost 8 out of every 10 individuals has some form of depression. Depression leads to suicide. We have certain psychotic conditions that we see very frequent within our population, which we are also focusing on. I know there is a development of a policy for suicide prevention that is taking place presently. So that will come out soon. So we are focusing on mental health care. It's not
Even violence.
But all right,
Yeah,
I was
that's-
going to it, because the violence itself creates a whole ambient of mental health problems for the people living around. I mean, post-traumatic stress. We've been working with human development, education. We restore Belize to look at that aspect as well. And mental health is an important part of that. The stories we hear are mind-boggling.
Yeah.
But then there's the other aspect of, in societies, you do have always hidden mental health problems. The issue for us is, one, human resources. We have a problem getting psychiatrists or psychologists in the country.
Yeah.
And most of them, we have to bring them from abroad and try to offer them an attractive package, and they're so in demand that you can't even get them. We try to offer a good package,
and then they
find
have
it somewhere.
such a huge load when they're here.
And when they come here, they're overloaded. So it's something that we need to address. We're trying to get more scholarships for people to go and train in psychiatry and psychology. We're doing right now, I think with UB, a cohort of psychiatric nurse practitioners.
Okay.
So that we have because that's important. You need to have qualified people to be able to provide the services that you
Absolutely.
need. And then you could go into a proper screening program, identification, treatment, and management. We've been discussing also with UNICEF to see how, for adolescents, because that's also a critical period when people are passing through adolescence. Apart from all their social, they go through hormonal, physiological, which creates another issue for them.
And that's where sometimes the illnesses manifest.
Correct.
Yeah.
And so trying to see how we can use technology to be able to access the specialized care we have from abroad. Because I think the technology now makes it a little bit easier not to be so dependent on human resources here. If we have somebody specialized in North Carolina, let's say, who's willing to work with us over Skype or over internet counseling, if we could put that in schools where you have adolescents or those are ideas that we're trying to mature to see how we can expand the services to assist people. But as you can see, it's on different fronts that you need to be dealing with these issues.
Facilities.
And I was going to get there. I cannot have you
And
leave.
then
Cannot have you leave. And I find this is a topic that I'm very passionate about. So I know there are many different areas we can discuss, but what is paramount to people is healthcare, and the theme, obviously, healthcare for all, is important, and we have to talk about the KHMH seal. Where are we? I feel like if we spend too much time going into how we got here, we'll be here for a very long time. But what we need to know is that the situation is being addressed and that there will be proper facilities in place for people to access the care that they need at an affordable rate at the public hospital. So please tell us.
Okay, well, you know that any investment in these facilities are huge to start with. So you need to be able to access the necessary financing.
Mm-hmm.
You're not talking about $1 million, you're talking about
Yeah.
$50, $60 million at least per facilities. And you need KHMH, you need Western Region, you need San Pedro, you need at least Southern Region. So you're looking at, we acknowledge that we need those things. With KHMH, all right, with KHMH, part of the problem, and as I don't know if you know that there was a structural problem, probably magnified by seismic activity that created showed us where the problem was. Right now it's been dealt with in terms of stabilization, stabilizing it. We have an area that's non-functional in the sense, for the sake of protection of patients and staff, should be 20 feet on each side of where they have the faults. We have the assessments done, and right now I know KHMH will have to tender out. There's a solution, it can be repaired, but long term, I mean, that solution we can repair. We need to invest probably a couple $1 million in addressing that structural fault. KHMH is moving through the process, but long term, I think we've been discussing the need to have a proper referral hospital. Now adopting new concepts of how a hospital shouldn't be so large. It should be more specialized, and you manage people more at their home, not in a facility. So those are new concepts that we need to implement. But I think at the end we will need to have a referral hospital that's not
in the center of town.
We have to address the issue of disaster resiliency and exposure to major floodings with global climate change and all and disaster. So we're thinking maybe we need to build it in Belmopan. Maybe that will address two things. We need to update the Belmopan hospital. We need to build a new hospital in Belmopan as well. So probably build a tertiary facility there with secondary care, and KHMH becomes maybe a secondary care hospital for Central Region, because Central Region needs a secondary.
Of course.
Part of the problem with KHMH, right, and the overload is that they function as a secondary facility for Central Region, and the key includes the keys, and as a tertiary referral facility for the whole country.
Yeah.
Wow.
So,
But I hear you say probably, and this is something very crucial to a developing country, having quality healthcare available. What is the timeline for us to move into whether, I mean, I don't foresee how you can ever enhance, you can fix what is at KHMH, but obviously I agree, there is a need for a brand new facility. But where are we in the timeline for that? What is the priority for us to be able to have a new structure to offer this care for all Belizeans?
we have already approached from, as I said, we had KHMH came in to complicate matters, yeah. to be frank with you. But we are already moving in terms of submitting proposals through CABE for a hospital in Belmopan. We're working with private investors. In San Pedro, we're looking at a private public partnership, because I think the private investors would be attracted to an area that's highly touristic. So we're looking at that, and we have interested parties to develop a hospital in San Pedro. So that's sort of taken care of. Timeline, as things go, I've been in this for long, and those things take 3-4 years at least if you're moving fast enough, if you're pushing. In PG, we also have a submission through CABE for a proper hospital. I think we need to find the land and so on. So the only thing that has changed with Belmopan is that while initially we were looking at a regional secondary level hospital, now we're looking at maybe a tertiary level national referral hospital with secondary level facilities, and separating the primary care clinic, having a polyclinic separate from that, learning from past experiences. So timeline, it's not immediate. In my estimate, it would maybe be 3-4 years at least.
Mm-hmm.
Assuming, and that's assuming that we're pushing.
Yeah.
We're pushing. So.
In addition to everything else.
In addition to everything else, so we're on multiple fronts. But that's the whole issue of universal health care. It's a work in progress. As I said, it's an aspiration. It's a long-term goal, and you go building it little by little. You go expanding little by little. Mm-hmm. You have challenges because while you're expanding it and you're covering your priorities, there are people outside who are not within those priorities who are demanding, rightly so, that they be taken care of.
Yeah.
It's a complex. I think Mr. Trump said he didn't know that healthcare was so complicated. I think he made a statement. It is. I could have told him from the beginning.
So I wouldn't be
we don't go that route. Yeah.
But obviously, in looking lastly at the healthcare system, we know, and we were speaking before I went on air, that Belize was far ahead of its time when we rolled out NHI. But we're 18 years later, and we still haven't been able to complete that rollout. In the foreseeable future, what is the plan for NHI?
Again, and get right to the point, the problem is financial. We've been trying to make a case at the highest policy level that we have to invest. People are spending money out of pocket for healthcare. The basic idea is that we need to tap into that, and so what I was saying about the taxation, you cannot rely on, there's no way government with the present collection and their budget from general revenue can finance the rollout of NHI. They can maintain what we have. I'm not sure we can finance the rollout because they have competing demands. Our position is that there has to be health tax. That's, again, I speak from a technical perspective.
Is there anywhere that this has worked, especially in a developing country?
Oh, yeah, I mean, in Canada, you pay a tax for their healthcare system. The UK, you pay a tax for their, and people, you can't take away the National Health Services from them. They instituted the National Health, and that's my argument, they instituted the National Health System in the UK after World War II, when they were, I mean, their social structure was completely destroyed. That's when they instituted the and right now you can't take out, even though people complain, you can't take away that healthcare system from them, because it's an investment in the development of the country as well. So I think, me personally, and I'm not speaking as CEO of health, right? I think that people are willing to pay for it if it goes right back into healthcare, and if we can deliver on the quality and access of healthcare the way, because we've done surveys in the South Side. When we started in 2000, we've done a couple surveys where people are saying, listen, for this, I'm willing to pay for it, but I want this.
You want to know the money's going there.
You want to know the money is going there.
Yeah.
So
That's
our argument is that it might not be simple coverage through, or the amount of money you need is may come only taxing people. And again, you have to work with the Chamber of Commerce, you have to work with public service, you have to convince. It's a social, it's a value system. I keep saying it's a value system for our society.
Yeah.
If we are our brother's keepers, if we understand that healthcare is necessary for everybody, if we share the burden of that responsibility financially, then we shouldn't have a problem doing that. And then you have other alternatives, like you could tax tobacco, alcohol, you could contribute from social, you could look at different, so we've had the studies done, we have the proposal there now. Our job is to be able to convince policymakers that this is the way to go.
All right.
As we were talking, we started off 2000. I always say 2013 or 2010, I think the World Health Report came up with financing healthcare, and they spoke about the National Health Insurance Scheme and risk pooling. We already had that in 2000. We had the elements of a system that could move us very quickly to a universal health care eventual goal. So we started off, we introduced it in the Caribbean, by the way. Belize was the first one to go and present in the Caribbean the whole concept of a national health insurance. Many of the countries in the Caribbean have taken up the model.
But we stopped at the first stage.
But we haven't, our only step that needed to be taken was to introduce a healthcare tax to finance the NHI.
Right.
And that's where we are in the debate.
So that's your very important lobbying to take place. And let's do one final lobby, Dr. Zuniga, to why people can do their part as well, individually.
Yeah, well, when we look at primary health care, a major aspect is self-care management. And so it is the individual's responsibility as well to take up his health as an issue. Because we can only do so much. And we can only create awareness to a certain point. But it's up to the individual to take up that proposal, or to take up that awareness, to make that change. And as we were saying before, most of the conditions that are affecting our population are preventable, but it's up to the individual.
Can I make one little plug in here?
Okay.
Saturday is a World Health Day event. And Saturday we're having a CEO caucus ride as well, which is to raise funds for cancer, which is one of our challenges in this country. But also it's to start promoting healthy lifestyle. All right, so I just want to plug that in.
Okay. Thank you very much for being here. We appreciate you sharing all this information with us. And we hope that people will be paying attention to some of the important warnings as well. We're going to go ahead and take a break. And when we come back, we will be speaking to 2 scholarship recipients. They are moving to Canada on volleyball scholarships. We'll hear all about their story after the break. So stay tuned.